Good morning, everyone, and welcome. On behalf of Renewed Start Georgia Collaborative, we are truly honored to have you join us today for this powerful and necessary conversation called Awaken by the Silent Cry. Whether you are here as a mother, a supporter, a professional, or someone simply seeking understanding, we want you to know that you are in a safe and compassionate space. Today is about bringing light to what is often hidden, giving voice to what is often unspoken, and extending hope to those who may feel unseen or unheard. Postpartum mental health is real, it is tender, and for many, it is a silent journey. But today, we are choosing to awaken, to listen, to learn, to support, and to stand together as a community. We encourage you to engage with us throughout this live. We want you to share your thoughts, ask questions, and most importantly, allow yourself to receive what you need from this space. Thank you for being here, for showing up, and for helping us break the silence. As we move forward, we invite each of you to settle in, plan to journey with us this morning from 9 a.m. to about 12 noon. However, we may get finished a little sooner. But we want to guide you through what to expect. We will begin with an opening address from our host and executive director of Renewed Start Georgia Collaborative, Dr. Tenisha Bibbs. Following that, we will hear from both Dr. Tenisha Bibbs and Georgia State Representative candidate for House District 68, Tamoria McQueen Saba. From there, we would transition into a special recognition segment along with a proclamation reading as we take time to honor and acknowledge the significance of this moment. And after that portion, we would then take a brief intermission. When we return, we will move into our community forum, which will be held in two panel sessions. Each session will feature a group of panelists who will share insight, expertise, and lived experiences to help deepen this important conversation. Finally, we will close out our time together with concluding remarks from Dr. Tenisha Bibbs. We encourage you to stay engaged, remain present, and lean into the conversation. This, again, is a safe space for awareness, education, and community connection. Thank you for being here with us. So at this time, you will hear from our host and executive director of Renew Start Georgia Collaborative, Dr. Tenisha Bibbs, as we share more about who we are, our initiative in a short video presentation.
Hello, and welcome to Renew Start Georgia Collaborative. We are a 501c3 nonprofit organization rooted in compassion, action, and change, dedicated to improving postpartum mental health in Georgia. We are history makers. The Renew Start Georgia Collaborative is proud to stand in purpose with an official proclamation in the state of Georgia, recognizing May 2nd each year as a day to uplift and bring awareness to postpartum mental health. This moment is bigger than us. It is about pushing resources forward, breaking the silence, and making sure every mother is seen, heard, and supported. Together, we are not just raising awareness, we are creating change. Our vision for change: we are committed to reducing postpartum mortality by improving access to comprehensive, high-quality postpartum support services. Through intentional efforts, we aim to develop a leading Georgia-based model for postpartum mental health advocacy that can inspire change beyond our communities. By championing awareness and action, we strive to create lasting impact and lead the way in advancing postpartum health outcomes for all mothers and families. Our mission. Postpartum mental health is our mission. We are committed to advancing postpartum mental health by creating safe spaces for education, support, and open conversation. Our work centers on ensuring mothers receive the care they need after birth, emotional, mental, and holistically. Through meaningful community partnership, we expand access to resources, strengthening support system, and bring awareness to the realities many mothers faces. By prioritizing postpartum mental health, we aim to shift the narrative around maternal mortality and ensure that every mother is seen, heard, and supported beyond childbirth. Postpartum mental health is a crisis. Georgia ranks among the highest in maternal mortality in the United States, with postpartum death continuing to rise as a serious and growing crisis. This reality highlights an urgent need to close the gaps in care, support, and accessible resources for mothers after childbirth. By bringing attention to postpartum mental health, we push for stronger systems, earlier interventions, and community-based solutions that truly support mothers during one of the most vulnerable times in their lives. So our focus for 2026, we are committed to expanding community outreach and educational incentives or initiatives that supports mother and families during the postpartum period. By building meaningful participation and maternal and newborn organizations, we strengthen our ability to provide access to trusted resources, supported systems, and culturally relevant care. Through hosting and collaborating on events, we create space that center postpartum mental health, promote healthy recovery, and increase community awareness and education. Our goal is to ensure that every mother has the knowledge, support, and community she needs to thrive beyond childbirth. So here is our collaboration and partnership initiative. We collaborate with diverse network of partners, including hospitals and clinics, community doulas and midwives, mental health providers, and faith and community leaders. Through these partnerships, we extend our reach and impact while also engaging directly with families to provide support, education, and meaningful connection during the postpartum journey. So here's our call to action. Join us in raising the standard for maternal health by partnering with the Renew Start Georgia Collaborative. Together, we have the power to transform maternal and postpartum health across Georgia through collaboration, advocacy, and action. We invite you to explore our maternal series, our postpartum series, where you'll find valuable resources, practical tools, and meaningful ways to support and uplift mothers in our communities through the renewstartga.com platform. We want to advocate or support advocacy, supporting legislation that extend postpartum care coverage. We are educating by raising awareness about the signs of PMEDs and available resources. We also support partners with organizations that provides community-based care. So how can you get involved? You can scan the QR code to Renew Start Georgia's first interest meeting, and you'll get that information. And then we're inviting passionate individuals who want to make a difference in postpartum and also maternal health. You can go to www.renewstartga.com to sign up. We say thank you so much for allowing us to give you our presentation, and we look forward to doing support advocacy through supportive initiatives.
Awesome. So now that you have heard our mission and our vision and our initiative, we are about to now have our very first conversation. Listen, remember to put your questions in our chat, and we will try our very best to get to them all. However, make sure that you are engaged. Now, we want to now go ahead and introduce and welcome both Dr. Tenisha Bibbs and our guest, Georgia State Representative candidate from the House District 68, Tamoria McQueen. So let's give them a warm welcome as we begin to bring them onto the screen. We want to say welcome, welcome, welcome. All right, so I first want to say thank you, Dr. Tenisha Bibbs, for your vision and your passion to help bring awareness to our community regarding postpartum mental health. I'm going to turn it over to you at this time.
So I want to truly say thank you, Dr. Carla, for that. I am truly honored to welcome you all today. Thank you so much for taking the time to join us for this important and meaningful conversation. I would also like to extend a heartfelt thank you definitely to our incredible speakers and moderators. Moderator, your presence, your voice, and your commitment to the work are deeply appreciated. You are helping to create space for truth, healing, and real change. I also want to give a brief, share the work that we're doing here in Atlanta at the Asadula Center. Our mission is to create strong, supportive postpartum care for families by providing education, screening, scans, peptide support for our postpartum moms and families. We are committed to ensure that no mother feels unseen or even supported. Also want to recognize our honoree today. Your dedication and your leadership and your commitment to advancing maternal and postpartum mental health is truly inspiring. Because of your work, lives are being impacted, awareness is being raised, and real change is happening in our communities. We honor you today and thank you for the difference you are making. Thank you, Ms. Tamor, for all the amazing things that you're doing, especially with the legislative and all of the changes that are happening. And I'm so grateful to have you on today. And today we are together through the Renew Start Georgia Collaborative. We are sharing purpose to raise awareness, create space for real conversations, and push forward meaningful change in postpartum mental health across the state of Georgia.
Good morning. Can you hear me okay?
Yeah, we definitely can.
Good morning, Dr. Carla, Dr. Bibbs. Thank you so much for the warm welcome. Thank you to all my fellow panelists. Some of you I know and some who I'm just getting to know. This is a really important conversation, and I thank you so much for opening it up. And I think it's also important in context of what's been happening this past week with the Voting Rights Act. So just to give you a brief background on myself, my name is Tamoria McQueen Saba. I am a maternal health advocate and policy strategist. I'm also a candidate for state rep of Georgia House District 68. So a lot of times when people sort of ask me, how did I get into this? It can be a very short story, a long story. I'm going to give you the short story today. So 16 years ago, when my oldest daughter was born, I had a postpartum hemorrhage and I almost died after a 27-hour-long labor. I was diagnosed with PTSD. 13 months later, I had a miscarriage in the middle of a frozen yogurt shop while I was out with my baby, a friend and her baby. So I went through 2 maternal morbidities in about a 13-month time frame. So I was re-triggered and I was still dealing with the PTSD that I had the year prior. So I started going to therapy, but I found also that there weren't a lot of resources for not only women, but also for men and just families in general, you know, for people who, 1, had a birth trauma, and 2, were experiencing the mental effects of that birth trauma. So for me, it was PTSD, post-traumatic stress disorder. And I also developed a debilitating anxiety. It was horrendous. Like I was always so afraid to leave the house. I always thought that something was going to happen to me or my daughter. I was, you know, I didn't want strangers coming near me. I would get very jumpy. I was always super anxious. We were living in northern New Jersey at the time, outside of New York City. So I was used to taking the train, and I would just be so nervous that we would like get trapped in a train. So I just had a lot of those types of thoughts. So I came to a point in therapy where I was doing really well. And I asked my therapist, I really feel like I want to share this story. It feels like I need to connect with other people. I can't be the only person who's experienced these types of things. And she said to me, But what do you mean when you say you want to tell people? I said, well, I've been writing a lot about what happened to me, but I think I also want to share it publicly. And so one of the things that she helped me navigate was when you speak about a particular issue, especially mental health, because we know how polarizing that can be. She said that you will now have to own that label. So are you comfortable with people, even if you're on the playground, saying, that's the mom that had PTSD or has PTSD or has a lot of anxiety? If you're going to be sharing these things publicly with the world, they do become part of your identity. So I just didn't feel intimidated by that. I felt like it was a really important conversation to have. And I remember the first day that I actually shared my story online. This was in 2012. And I was standing in my, it was like, like 1 a.m. I'm going to hit the publish button now and tell the world all these things that happened to me. And when I hit the publish button, about 5 minutes later, I got a tweet right back. And it was from a woman in South Africa. And the tweet said, "Dear Timoria, the same thing happened to me. I also have PTSD, but I live on a rural farm in South Africa. Can you help me?" And there I was in my kitchen in New Jersey going, oh my gosh, like I do want to help her. And that's sort of been the driving force for me since. I never want someone to ask me for help and I'm not able to give it to them. So part of being an advocate that is connected to being a legislator is the fact that a legislator has to basically make sure that community needs are translated into policy. So there's a big difference between an activist, an advocate, a lobbyist, and a legislator. They all do. There is sort of the foundational aspect, of course, that, you do want to address community needs. But the only way that they actually get taken care of is through legislation. And what I mean by that is taken care of in a way that has long-term sustainability, so that we can make sure the resources are stable for decades, not just temporary. So a lot of times we depend on our just our disposable income that we have as individuals to sustain things through fundraising and all that. But it's really through legislation that we can guarantee that funding and policies will be set in place for decades and hopefully centuries to come to address community needs. So just wanted to start off with a brief overview of myself and that type of work before I get into my boring PowerPoint. Boring looking PowerPoint slide. I'm like, my PowerPoint slide game here. I'm like the most, not the best at that. So, okay, let me go ahead. So, there's a nice picture of me in front of the State House. So yeah, so today we're going to talk about Georgia health policy for this year. So first, I always like to ask people, what do you think health policy is? And it's just a very long, sort of drawn out answer, refers to the decisions, plans, actions, and regulations enacted by governments and organizations to achieve specific health goals, improve healthcare access, promote community well-being. But it also guides actions in public health, healthcare financing, and delivery systems, addressing factors from disease prevention all the way to insurance coverage. So we have to look at this as both it's a systems level. We're addressing things, the local level, but also there's a part of it that is a business that I think people do forget. Hospitals are a business, insurance companies are a business, so sometimes we don't think of the words financing and, all that when it comes to health policy, but that really is the driver. We're always talking about the fact that we're going to need money. Money is the most important piece a lot of times in terms of how are we going to address community needs. So key aspects of health policy include, so we have the focus areas. So we're going to talk about, there's the financing, Medicare, Medicaid, the access to care, pharmaceuticals, public health initiatives like we've seen before, like when we had COVID, we had to have a big immunization program for that. Who are the decision makers? This is, especially right now, this is one of the most important things. The policies are created by your local, state, and federal government. So one of the things I want to talk about is those differences in local, state, and federal. So a lot of people, we get caught up, of course, especially how crazy right now with the world is, but especially in DC. I think we hear so much about what's happening in DC, that we tend to forget about what's happening right here in front of our faces at home. We can never, whatever happens in DC, yes, is it going to affect us? Of course, but really we have to pay attention to our state level and local level. Those are the things that are going to impact our actual daily lives. So right now, as you know, we're in the midterms and we're in the middle of an election. Election day is May 19th. We're in early voting. Everyone really needs to be studying the candidates in their district and what they stand for. They need to ask themselves, does this person have experience in doing these jobs? Are their policy goals something that align with my policy goals? Do their values align with mine? So the goals of health policy, as you can see, are to improve population health, increase equitable access to care, and ensure efficiency and quality of health services. You have to ask yourself, does your current legislator do all of that? Are they addressing those things for your community or not? And is it time for a change? Who do we have currently in the State House, or who is running that will actually address these things? That is very important, especially as it pertains to maternal health and reproductive health, and women's health in general, right? Because we also have to respect the fact that not every woman is going to be a mother, and that's fine, but she still has all the parts and pieces. And so, we need to respect her reproductive health and her choices. So health policy functions as a tool to establish a vision for health, outlining priorities and setting measurable targets. So we need to make sure that our representatives are people who are going to be doing that. Okay, so as we know, we've heard all these numbers before, but I just wanted to put them up here in case people haven't. Georgia's maternal health crisis. We know that we're having a maternal health crisis with an 87% preventable death rate, which mostly affects Black women at a rate of 3 to 4 times as much as white women. Now, when we use the term 3 to 4 times as much, what I want people to sometimes think about is that that's a national number a lot of times. So it's quoted, but I can actually find places in the country, including Georgia, where the number is 8 times higher, 10 times higher. So we're just usually taking the average of all of that when you hear that. Even in New York City, there's places that are 8 times higher, 10 times higher, right? So I can take you all across the country and give you numbers like that. 93 rural counties here in Georgia lack obstetric care, and we've labeled them maternity care deserts. So what does that mean? That means that out of the 159 counties in Georgia, that 93 don't have an OBGYN or childbirth services. Can you believe that? 93 rural counties are just, so think about with what I told you happened to me, and I'm sure we've had stories that we know of other people. Think about if I had those types of emergencies like I had at the frozen yogurt shop. And instead of going, at that time, we lived super close to the hospital. I think it was like 4 blocks, 5 blocks away. If I had to drive even 30 minutes, an hour, 2 hours, we have families in Georgia who have to drive 2, 3, and sometimes even longer hours to just be able to get the proper childbirth and pregnancy services that they need, the perinatal care. And as far as mental health, I don't think a lot of people realize that in Georgia, there are 30,000 mothers a year experiencing perinatal mood and anxiety disorders. We know that one in 5 mothers is going to experience one in general. And a lot of people don't realize 1 in 10 dads will too. So this affects men as well. So in Georgia, more than 50% of new mothers report feeling down, depressed, and hopeless. So the state really needs to implement more strategies to support its mothers and their families. So we do have evidence-based models such as home visiting and treatment, but they're not widely accessible. And so again, we need to be looking at, if we are truly going to call ourselves activists, advocates, lobbyists, then the pressure really needs to be put on making sure that the legislators that we have address these issues, or we need to make sure we're looking at people who will be addressing these issues and support them in their run for office. So we do still have several restrictive laws in effect here in Georgia. As you know, the heartbeat bill, which bans abortions after about 6 weeks. So one of the stories that I haven't had a chance to really tell this too much publicly, but I don't shy away from it, is that when I had the miscarriage, I actually had to have a DNC, a dilation and curettage. A lot of people don't know the term. I'm sure a lot of you do because we're all in, my Amen chorus with my panelists here. But that is technically a legal abortion. That's technically what it falls under. If I hadn't been able to get that type of care, I would have died. I would have just bled to death, right? They had to remove all of those things from my body in order for me to live. So based on this law, and I was right around that time frame too. It was right around 5 or 6 weeks. I don't think I was that too far along. So then I found out that I lost my child. Now imagine if I wasn't able to get that care, and then the daughter I did have, now she's without a mother, all because I wouldn't be able to have gotten that type of care. So these are the realities, and these are things that have actually happened to women here in Georgia. This is about life or death. And legislation is about life or death. Policy is about life or death. I cannot stress that enough. So also, as we know, we have the restrictions on midwifery. Now, Dr. Sylvester was at a talk I gave on the history of health policy, where I took us basically from 1619 all the way to the present day. And one of the things I talked about was how we were doing just fine for thousands of years as Black women and Black people giving birth before midwifery and our traditional customs that we brought over from Africa were stripped away from us and made to be demonized, all to support, basically that new traditional white male model of what obstetrics and gynecology should look like. And so once our traditional ways of managing our births were stripped away from us, that was the beginning of our poor outcomes. So again, you have thousands of years where our outcomes were just fine. And then when we were brought here and, once we were taking care of everybody else's kids and we were still thriving under horrific conditions, it was another way, again, policy-wise to affect our human rights and our way of living and our survival rates as well. I don't know how much you guys know about the Georgia Maternal Mortality Review Committee. So when I first got here a few years ago, I thought this was so interesting to me, and I was surprised it wasn't a bigger story. But the Maternal Mortality Review Committee, the MMRC, had to disband a couple years ago because someone was accused of violating someone's HIPAA. So they sneakily sort of got back together, if you will, but no one knows who's on it. The members aren't publicly listed. So when you think about who you are going to support for a legislator, for people running in your district, with state rep, senators, attorney general, Supreme Court. I'm going to tell you, Supreme Court's one of the most important ones as well. Really think about who's going to fight for you to get in there and get that information. Because I know for me, first day one, I'm going to be like, I need the list of the people on that MMRC. I need to bust up in there, right? Like that's going to be like the first thing that's on I think about it all the time. It's going to be the first thing I ask for. I need to know who these people are. So basically, what are the results of these things? Well, the limited access to care, especially once we get outside of Metro Atlanta. I remember before I moved here, there was always this saying, just remember, Georgia is bigger than just Atlanta, and I actually live outside of Metro Atlanta. So I'm always stressing to people, even in my community, we're about 30 minutes south of the city, 25 minutes south. But we really need to make sure that we're creating more resources so people aren't having to feel like they always have to drive into the city for certain things. The other result that I don't have up there is death, right? Like restrictive laws result in deaths, so that's a really, really important thing to take away from all of this. We have to really start being more bold in our language. We have to stop being so nice. I think we have to really focus on, we want laws that protect us, whether it's voting rights, whether it's reproductive health, whether it's environmental protections. We want legislators who are really going to say the things that need to be said, not focus on being palatable, but being effective leaders for their communities. Okay, so there's been some recent wins, and there's been some stalls as well. So postpartum Medicaid was extended from 60 days to 6 months. However, now they're trying to extend it 12 months. It's been proposed but not fully implemented. There was a loan repayment program for obstetric providers in rural areas. Sorry for the typo there, guys. I was doing this a little late last night, just going over everything, and I forgot to correct that. But anyway, this is what tends to happen with a lot of bills. So a legislator will write the bill. You know, you guys know I've written a bill that was actually signed into law as an advocate. It was called the Act to End Inequity in Maternal Health when my family lived in Massachusetts. So, you know, it's not an easy process. You know, you write the bill, you collaborate with people, it goes through editing, all these things. It has to go through several readings, first the House, first the Senate. So this has been in its second reading, which means it went through the House, you know, they read it, and then they said, okay, this deserves a second read. And now it's been over a year and it's just sitting there. And so same thing that I put below with HB 1215, Dignity in Pregnancy and Childbirth Act, which would require, and I think this is one of the most important things that can be done, requiring implicit bias training for healthcare providers. It's been in a second reading since last March. And for me, again, I think it's time to be a little bit more bold with the language that we're using. So for me, I wouldn't even, of course, requires implicit bias training, but I think we just need to say anti-racist, right? Like that's really where we are. Like we have to really just be saying the things. So for me, yes, you know, if I were to rewrite that bill, it would definitely have a little bit more bolder language in there, requiring implicit bias, anti-racist. And I think it you know, it works a lot of different ways, right? So if you've never lived in a poor rural white area, right, I think that students should be trained to go there. If you know, but we know as Black women, it doesn't matter, you know, what level of education, how much money you have or anything. We are being affected more by these issues because of race. Race is the factor. In 2021, the CDC declared race as a public health crisis. Now, let's think about what happened when COVID was declared a public health crisis. We had a vaccine within a couple of months, right? Like it was, but think about with racism, you know, there was no, you know, there's no vaccine for it. So what can you really do? Well, you have to mandate it. It has to become a law. So that's why I'm stressing it is so important to pay attention who your representatives are at every level, even on your school board, even on your local health committee, your local council people, your commissions. Really do the work to study who all these people are and what they believe in. But as far as the things that are going to be implemented statewide, it's your state representatives, there's your Senate, and of course, the governor. And I want to talk about this a little bit because we do have, you know, all these people running for governor as well. There's 6 people in my race, and there's, you know, I call it a clown car. In the governor's race, I call it too, because there's so many people always kind of, you know, it's like piled up with a bunch of people. So one of the things that I have to think about as a policy strategist and when I'm writing, I actually start at the very end and I go, is this person going to sign this? That's where I actually need to start. Is all the language I'm using in this bill something that when it gets to that governor's desk for signature, he or she is going to say, yep, got it. Or are they going to veto, right? They're going to say so. And that could be after anywhere from 1 to 5 or 6 years of work to develop a bill that has finally moved through all those committees, all those readings, passed through the House, passed through the Senate. And at the very end, this one person could say, no, not happening, right? So it's really important to research, again, every single part of that ballot, research it and make sure that whoever you vote for has your best interest in mind, will fight for what you need for your family, whether it's food security, health, environment, voting. Do the work. And I'll make sure I have a resources slide coming up at the end, and I'll make sure I put them in the chat so you'll know where to find that information. So here were some of the new bills that were proposed this session. So as you know, there was the Momnibus Act, which would be a 3-year pilot program providing virtual prenatal care, mobile postpartum care in rural areas, expanding Medicaid for doula services, etc. However, this current session, they weren't even able to get, unfortunately, they wouldn't even pass a doula bill just allowing for 6 visits. I'll never, Representative Park Cannon, she wrote this bill, and I remember looking at it and we talked about it, and I said, Representative Cannon, this should be a slam dunk. I mean, you're just asking for 6 visits after? I'd be asking for a whole year, all this stuff. And it didn't make it through. So then, of course, there's the MMRC. It's like, now this one's a little tricky because this would give the committee access to mental health and pharmacy records. If we can't trust who's on the MMRC, I don't think we should give them access to someone's mental health and pharmacy records, right? Because then are they going to try to blame these maternal deaths and morbidities on someone's mental health or a prescription they had rather than racism or implicit bias or, some other type of thing, right? So that one I don't like for that. And then we have the maternal mental health, which of course would be great, mandating insurance coverage for mental health screenings both during and after pregnancy. So just wanted to make sure. Now, and sometimes these bill numbers change, so I do my best to make sure we stay updated. Sometimes, like, they go through a certain committee, they get another number. Sometimes they can even switch names. There's always sort of these amendments and editing, like, constantly happening. So it can be a lot to keep up with. But usually, if you're following a particular org, they will usually have the legislative updates on that. And I'll have some resources for you at the end as well on that. So as we know, here's the gaps that still remain. Like we talked about, 50% of the counties are maternity care deserts. Again, no hospital-based OB care, and limited midwifery and doula care as well. We don't have a postpartum Medicaid for 12 months is not yet law for all birthing people. We know that all families don't look the same. And we have to respect that as well. So we want to make sure that no matter what your family composition is, that you have protections. Midwife restrictions remain active unless the court changes them. And that's, again, that's the Supreme Court. We've got 2 people running for Supreme Court, Miracle Rankin and Jen Jordan. These are both women with incredible histories of reproductive justice as both attorneys, and so they have the experience and they have the knowledge. They are our last stop. They are our last stop, in terms of, so it's just like we have the Supreme Court on the federal level, we got to pay attention to our Supreme Court here. So again, that's Miracle Rankin and Jen Jordan for Supreme Court. We have limited care as a gap as well as we know. We know that we have that preventable death rate, critical gap, and we know the mental health gap. So how can you get involved? So the first thing is to track the bills, and there's the website for tracking the bills. You can even Google, sometimes like current maternal health bills in Georgia, and it will usually pull it up. You can call or write your state representative and senator, right? Especially if you live in a rural or maternity desert county, because a lot of times people don't realize, who actually does what. And that's why I keep reinforcing it is your state rep and your senator. So if you don't have access, it doesn't matter what your race is. If you don't have access, it's because of them. They don't want you to have it, period. They're not fighting for it. You don't hear them talking about it. They don't care about it. So you have to make sure this person really has your best interest in mind. You can testify or submit public comments during committee hearings, and there's also virtual options available. So this was one of the things I even had to get used to when I first started out as an advocate, I was like, I could just go up to the state house. Oh my God, you know. And I would just be like, I just show up. They're gonna just let me walk in. And then I got used to it. And why is that? It is the people's house. I want to reinforce this so much, all of you guys. This was something that I had to get comfortable with. And then once I got comfortable with, I loved it so much that, as you can see, my trajectory, you know, going from an advocate now to running for office over the last 15 years. But when I go into the state house, there's no sweeter words to me than when a legislator walks by and goes, welcome home, welcome to your house. A lot of them say that when you go in, and I'm like, I can't wait to say that to someone one day, right? But it's so special because it's true. Really, your vote is your voice. It is so important. And that state house, your tax dollars are paying for it. You better go in there and demand what you want. You know that meme with Denzel, I'm walking out of here with something like that. Like, that's how I feel. That's how I feel every time I go in there to advocate. I was there from this whole session at least once or twice a week from January when session started till April when it ended. And every time I went, I was like, I'm walking out of here with something. You know, it was always in my mind, you know, whether it was making a connection to a legislator, advocating with other groups. I advocated for voting rights, maternal health bills, you name it. Like it, and it felt so good to be a part of it. And they like to see that engagement. If they can't see you, they don't know. That's what I tell people. If they can't see you, they don't know. So we have to do our part too as citizens, right? And then we have something to talk about if they don't respond. Because I love nothing more than bringing it up to them that they didn't respond to my email, my call, I showed up. So you're not gonna tell a story on me that I wasn't up there, right? But if we cannot feel intimidated by this process, they owe us that. We elected them to do exactly that. They have to engage. They must be accessible. They must be transparent, and we must hold them accountable. I have demanded that as an advocate, and I fully expect the public to do the same with me when I'm elected. I welcome it. I want to be a very accessible legislator, and policy creation to me is formed with people's lived experiences. So I will be fully expecting to be writing my policy with my constituents as part of the process, not dictating to them how things should go. And like I said, so show up. We talked about that. Yep. Show up, find orgs with values and goals that align with yours, become an advocate, lobby for bills with them. And then it's fun. You just keep making new friends with similar interests. And it becomes, even when you're advocating for things and it feels, oh, this is so sad, it can be depressing. But when you're with a group, you never feel alone. So it's good. And then, of course, support candidates running for office. Okay. Now there's also the grassroots and coalition work. So now this is more of the advocate piece, the lobbying piece, right? Join or support organizations. Like right now, Center for Reproductive Rights is suing for midwifery access, demanding transparency. We want those names. We want to know what's going on. We want to see what happened. We want the reports. We want to know how those women died or the trauma that they had and who was responsible. What hospital was it in? How many were Black, Hispanic, white? What were where did they live even, right? So we can get the demographics we need, again, to address it. Partnering with rural clinics to provide transport, doula services, telehealth. And then the most important thing, vote. Right now we're in a primary and it's like, I know it's not the presidential election, so we don't get a lot of attention in these midterms. But this midterm is I feel like it's probably how people felt in the 60s. This is probably the most important midterm of our lives. I'm 48. I just turned 48 the other day. And I know for me, I have never felt like this in voting. I feel inside of my body that there's something to this election that will shift everything if we don't make the right choices. So, we've seen the shift. We know what's coming. I think, our ancestors are like, girl, come on. So we need to vote in these primaries. We need to look at all that, the entire ballot, do your research. And labor commissioner. You want to be paid a fair wage? You better look at who's the labor commissioner. I have a friend, Nikki Porche. She's incredible. She's running. Please check her out. But again, representatives, senators, your governor, health committee members, all these things. So don't just focus on when it's the presidential one. Think about, for this midterm in particular, think about who you want to be guiding you through the craziness that 2028 will be. I think that's a good way to put it, right? Like, who can lead me, right? Who has the strength? Because right now we need God's strongest soldiers, people who've been through some things, right? Who understand local, state, and federal level laws and who have fought for those things. We need the strongest soldiers right now who will be able to carry us through the tumultuous seasons that are coming. So please keep those things in mind. So then I'm going to give you an action checklist now, a little plan that you can use to create change. So we want to learn, you're going to stay current on legislation, and just start following maternal health orgs on their social media, subscribe to mailing lists. Even as a healthcare advocate, a policy strategist, someone running for office, it's like, it doesn't mean I know everything, right? There's always new bills popping up in this. So I make sure I follow legislators that I like. Even ones I don't like, so I can see what mess they're talking about. So I have like a counter argument, right? Like, you ain't gonna do that, you know. We want to share, we want to post about legislation, candidates, current reps. So if you have people in your district running, support them. Find out how you can get with their campaigns and make calls for them, canvass for them. Dr. Bibbs came out to an event all the way here. She drove from Cobb County to Fayetteville to support me at an event last Sunday. We had a great time. Thank you so much for that. We want to make sure we're sharing about these people, because let me tell you something, it's not easy to run for office, you know, and I've been a public person for a long time. So I was on the opposite side, right? So as an advocate, I'm used to just showing up and just making my demands, right, for my group of people, and then I'm out of there, right? It's this is a whole other thing where, you know, people, you're very exposed publicly to people making comments about you, your family, you know, threats, all sorts of things. So when people are presenting certain things to you on social media, don't get me wrong, we're in it to win it. We're there for the fight. But please know that there's so many layers, especially as women running, that, you know, and just people in general, especially nowadays, people feel so free of the mouth, right? Like to say things. So we're experiencing all those things in real time, all the time. So any support that you can give, it feels amazing, whether it's sharing a post, making a donation, small or large. Don't feel like, oh, I can only give $5, not going to mean anything. Let me tell you what $5 does for me. $5 sends probably like 10 to 20 text messages. It gets me probably like, I think like 6 or 7 canvassing cards, you know, so all those things make a big difference. Call your legislators, demand that they pass these. Call legislators who aren't supporting them. That's what I would say. Don't stay with your own amen chorus. I already know who's going to support them. I can tell, right? You know, based on, you know, who they are. I go outside of it a lot of times. Join a coalition. You know, well, obviously we have Renew Start Georgia right here. So this is a coalition we all can join. There's Georgia Watch. There's Healthy Mothers, Healthy Babies. The reason why I listed HMHB is because I like their legislative work, and they're easy to follow. They make it like a one-stop shop to follow like all the current legislation and keep you updated on where it's at. And then, of course, you can show up to virtual meetings. I know it's hard to in the schedule. And I always feel like they put these meetings on certain dates and times too, where it's hard, especially like I say they're not mom friendly hours at all. A lot of these like meetings. So I try to make sure I've signed up on my, if you go to most of the time, like your town or county's page, they will usually have a subscription. I just check them all. So I get all the notices for the Board of Education, the City Council, the commission meetings, whatever, so that if I can't go in person, I can at least listen where I'm at, or I can go back and watch later. But again, don't be afraid to go physically and meet these people. They're excited. They actually get very excited to meet you, and it's a good learning opportunity. So again, we have the solutions, but we also have barriers, but we do also have momentum. And so the question is not whether we can fix it, it's whether or not we will organize to do so. We have to really get ourselves together and fight like our mothers, grandmothers, and our ancestors who had the hardest time. We have to garner that strength now and get ready, and we have to do the work. We can do it. We can get through all of this, but we won't do it in silos. We have to work together in order to solve these problems. So it's one bill, one call, one vote at a time. And then I think, let me see, I have some. So here's some resources for you, and I'll put them in the chat as well. So my voter page, that's where you can see your voter registration status. It'll also give you your local polling place as well. We talked about healthy mothers, healthy babies. I put a direct link to the legislative tracker on there. You don't know who your legislators are, that's okay. Don't feel embarrassed about it. That's a very easy website to go to, Plural Policy, and you just put your address in, it'll tell you everybody. It'll give you everybody. And then who's running for office in your district, Ballotpedia. This is where you can learn a little bit more in detail about the candidate. So everyone goes on, put a little statement, answer some questions, links to our socials are on there as well. And then here's my contact info. Please feel free to stay in touch with me. I wouldn't give you my contact info if I didn't want you to. So you can reach out to me anytime with questions. My website is tamoria.org. My email is tamoria@tamoria.org. There's the QR code, which will take you straight to the website. And that's everything. Thank you so much. If anybody has questions, I do have a couple minutes. If you have time, Dr. Bibbs and Dr. Carla, I'm happy to take a couple of questions. But thank you all so much for your time this morning. And I hope everyone walked away learning a few things, and just stay engaged. Thank you.
Thank you so much. That was absolutely amazing. And we were sitting over here like, we have no questions. I had a slew of questions and you went over every last one of them. So we just, oh my goodness, this is amazing. And I look forward to supporting you and just look excited to see more of what you're going to bring to the table. So I'm just excited. You have anything, Dr. Carla?
I just want to piggyback on that. Thank you so much, Tamoria. Your presentation was so informative. And I said she literally answered every single question that I had. And I'm just so grateful and appreciative for the work that you do and all of your passion that goes into it, because I think many people don't realize how important this awareness is, this topic is. And I like the fact that you shed light on our African-American community, because I believe many of us at times, and that's why I'm glad we're having this platform, but we get so caught up in our day-to-day lives. We get so busy with the cares of just our regular lives of this world that we forget about these type of issues that are going on. And I really do appreciate that you took the time to tell us how we can get involved, what we need to do, what we need to research, and how to get involved with understanding the laws and knowing how to research and who to follow, because I think a lot of people don't even realize that this is a thing. And the mere fact that you pointed out about the mortality rate that women are experiencing after postpartum is mind-blowing. And I love the fact, I didn't realize I had so much to say. I love the fact, how you were saying, we want to know the race, the names, the ages of these people who are dying, that's swept under the rug, is kept hush hush. And I'm telling you, just your testimony alone just really moved me on how you had to have that emergency surgery just to save your life. So if I had any questions, I guess I would say, can you really tell the people how heavy this mortality thing is? Like, what are some of the numbers that you're seeing? Because I think people are so oblivious to, how really scary that is and what's going on.
So I think actually the scariest part of the numbers we don't see. I always say, I look at what we hear about on the news, and then I say, that's only what we hear about on the news, right? How many mothers and children have died, and the family went home thinking it was for one reason, and it wasn't the reason that was accurate, right? So I think the numbers are much greater than we hear about. There's very few stories that make it to a news cycle, and the ones that have, it's really because the families are adamant about it and the public become adamant about it. But what we need are for the legislators to become adamant about it, right? So we will see certain stories in the news cycle. We will hear people talking about it. So my mind goes, okay, well, now where we need to be writing, where's the legislative piece, right, that's addressing this? So has that happened? Yes, but it's very hard to penetrate this House and Senate because it is very hostile. I've been in there several times, like I mentioned this session. It feels like a hostage situation. We have a House and a Senate that is being controlled by Republicans who don't want to do any affirming care for anybody, really. I'm always like confused, like, you don't even want your own citizens to just be healthy? I don't care where you live and all this stuff. Like, because I always say this, when you help the most marginalized of people, you help everyone. It actually trickles up, not down, right? I think we sort of think, oh, resources trickle down. In this, it actually trickles up because if we're helping the most marginalized, the poorest, the weakest, right? Or even, again, like, this has nothing to do with money as far as Black people in education because it affects us as a whole no matter what. But if we don't triage it, are we just going to let people continue to die? So, and I think, again, if we go back to what I told you about me, I guess the answer would be yes. They would have just been like, oh, well, she died, So I keep thinking, if I had lived here then, my daughter, I have a 12-year-old and a 16-year-old. So that was the baby in between. So my 16-year-old wouldn't have a mother and my 12-year-old wouldn't be alive based on Georgia law. That's the reality. So I'm always fighting for the people we don't see, right? The people who died, right? Like, they don't have a voice, right? And then of course there's the people like me where sometimes you kind of get told like, well, just be happy you live. But what did I live with? Trauma, lack of resources, right? Lack of knowing what my resources were. One of the conversations, I actually did a talk at the State House where I talked about how I didn't even know doulas existed when my oldest was born. If you imagine how I would have been just, I think, better off mentally, having someone there to advocate for me throughout a 27-hour-long labor would have been amazing. Even facing the choices, being asked, questions, about the type of surgery I was going to have and being told I might die that night, having to navigate all those things after just giving birth. It would have been amazing to have an advocate there. So I try to do a lot of educating patients about their choices, about what relationships should feel like to you. Doctors are like dating. If it don't feel right, baby, get another one, but you don't even have one in your area to choose from, what are you going to do? So I need to make sure as a legislator, I have to give people choices first before I even tell them choose another one, right? Because some people don't even have one. So there's a lot of layers to it. Definitely. And as a legislator, like, you really have to understand those layers. And for me, I've lived it. I have lived all the layers of this issue, which is why I feel, so excited about running for office.
Wow. And you know what, Ms. Tamora, we're so grateful that you have stepped up to be a voice and an advocate for us. And I just want to encourage all of our viewers on today that are watching, that will watch the replay, get out and vote for Tamoria. Come on. We need her. We need people like her
Yeah.
in that position to help us. And
Yeah.
if you could just do us a favor, Tamoria, and put in our chat how the people can connect with you, how we can follow you, how we can contact you, because we want to get involved and support what you are doing. And although you cover some things in a presentation, but if you could just put it in our chat so we can snatch it and grab it quickly. But we just want to thank you again for everything that you do. Thank you for informing us, absolutely educating us. So I'm going to turn it over to Dr. Bibbs to have final words, and then we're going to get ready to transition into our next portion. Thank you again, Tamoria.
Yeah, thank you so much again. We just are excited about just watching your journey and being a part of that. So that's all I wanted to say. Yeah.
And I want to make sure you understand that you really are a part of it. I say, like, every person I've met, whether old or new, you are fully on this journey with me. And I'm very grateful for your support. I can feel your thoughts and your prayers always, and I appreciate it. Thank you.
Yeah. And I thank Dr. Catherine for connecting us as well.
Yeah, she's the best. I'm going to try to connect here. I'm not connected in the comments. So if I get logged out, I'm going to try to come back in.
Okay, no worries. Okay, thank you again. Thank you so much. All right, so at this time, we're going to just transition for a minute. Just go ahead and take a breather. I know you just taking all of that in. Woo! That was loaded. That was so amazing. But listen, people, we have to get involved. We have to find out what is going on in our community. We have to figure out how we can get involved, especially as an African American people. Listen, so many of our ancestors lost their lives in order for us to vote. And I was thinking about that the other day, how we are not taking advantage of that privilege. So let's get out here and get behind the people who's trying to fight for us.
Yes.
And I'm just grateful for Dr. Bibbs for this platform, for her to bring awareness to us, because many of us don't even know that this has been going on. We didn't even know that this was a thing, and it is so important. We want to live and we want to have a good life. All right. So at this time, I'm going to turn it back over to Dr. Bibbs so she can move forward into our awards portion.
All right. So before we get into our award, I want to go ahead and talk a little bit about the postpartum maternal mental health a proclamation that we have in Georgia. I'll read it, and then we're going to go right into our award. The postpartum maternal mental health challenges, including postpartum depression, postpartum anxiety, and mood-related disorders, represent serious and potentially life-threatening conditions that extend beyond temporary emotional changes, profoundly affecting the physical, hormonal, psychological, relational, and spiritual well-being of mothers across Georgia. And these conditions may present as persistent sadness, overwhelming anxiety, sleep disruption, intrusive thoughts, emotional detachment, exhaustion, identity loss, feeling of shame, and in severe cases, thought of harm, requiring early recognition, clinical support, and compassionate intervention. And untreated postpartum mental health conditions can significantly impact not only mothers, but also infants, bonding attachment patterns, partners' relationships, workforce participation, and overall family stability, influencing generational health outcomes. And many mothers in Georgia experience barriers to care, including stigma, limited culturally responsive services, gaps in insurance coverage, inadequate postpartum follow-up, lack of education during pregnancy, and minimal structured fourth trimester planning. And building a statewide culture of awareness, early intervention, personal accountability or professional accountability, and accessible fourth trimester care is essential to reducing stigma, improving clinical outcomes, and ensuring that every mother in Georgia receives the comprehensive support she deserves now. I, Brian P. Kemp, Governor of the state of Georgia, do hereby proclaim May 2nd, 2026 as Postpartum Maternal Mental Health Awareness Day in Georgia. In witness thereof, I have hereunto set my hand and caused the seal of the executive department to be affixed this 4th day of March in the year of our Lord 2026. Today, I want to recognize Dr. Catherine Sylvester, Community Leadership Award recipient, Renew Start Georgia Collaborative. Dr. Catherine Sylvester is recognized for her transformative leadership in achieving women's health through education, innovation, and advocacy. As the founder of Operation MIST, she has pioneered the development of smart wearable technology designed to support healthier pregnancies, empowering women to monitor their health in real time and identify potential concerns early. Through her work, she equips women with the tools and knowledge to improve outcomes, helping prevent complications and support safer pregnancies beyond transitional care setting. Her impactful, more than a period, educational experience creates safe, empowering spaces where women gain confidence, clarity, and control over their bodies across every stage of life. As a physical therapist, educator, preeclampsia survivor, and VBAC certified doula, Dr. Sylvester leads with both expertise and lived experience, championing individualized care and redefining how women are supported in their health journey. We at Renew Start Georgia Collaborative present this beautiful plaque to her. It is proudly presented Community Impact Award of the Year to Catherine Denise Sylvester, May 2nd, 2026, Dr. Tenisha Bibbs, Executive Director, Renew Start Georgia Collaborative. This thing is heavy. It's heavy, okay? And it comes with, we will be getting this to you. And you see how beautiful that is? So I just want to congratulate you. Would you have some words to say?
Yes, I have words to say. Oh my goodness. Thank you so much for the recognition. As you know, because I know you serve too, it's such a joy to serve, and you don't do it for recognition, but when you hear the words being said, the impact that you are making, it makes all the difference. So thank you. And keep helping us move forward and keeping the momentum going. When you have events like this and you hear from people like Tamoria McQueen and yourself and some of the other people that I know are going to be talking today, our future is bright. It is hopeful. We know that all the resources that we need are right here in our community. And it takes people like you, events like this, to bring awareness to that. But it also takes moms. I hope the moms and families listening to this today hear that we are here for you. And if you need anything, you can reach out, that your body was absolutely designed to give birth, that you can find providers who want to support you and who will do what needs to be done to make sure that you are not only safe and survive childbirth, but that you thrive afterwards and that you're in control. The reason I like to be out here in the community is because people can pick me. They can pick us and say, hey, I want her on my team. I want what she's offering to be a part of my support system. Because just like coaches, I think about coaches and how intentional they are about scouting for players years before the draft, because they want to make sure that the people they bring onto their team are the right people. And so I love being a part of people's teams and then knowing that they have the ability to choose. So thank you for the award. I'm
well deserving.
So honored.
Well deserving.
And,
well deserving.
I can't wait to feel that heavy award.
Yeah, girl, it's really heavy. This is, is it going? Okay. This is part of the reason why the Ask a Doula Center is created for things like this and to be able to support and collaborate, because this is what we're doing. We're educating, we're providing screenings and scans and getting into new innovative things like peptide therapy, and just to support our moms during postpartum. I have a flyer that will be shown today to show that, we can be in this space. And I thank you so much for what you contribute to pregnancy. People don't understand it. Just that pregnancy part is everything. If mom can get through that and to learn her body and to know what's going on and to have a, people that are in her network. I keep stressing that you have to know who's in your network. You know what I mean? To support her. So thank you for being an advocate. Thank you for being in front of this right when the mom gets pregnant. You're there to support her through that process. And I appreciate you for that.
Thank you.
All right, everyone. So wasn't that amazing? We definitely honor Dr. Sylvester on today. It was just beautiful, that presentation. Thank you again, Dr. Bibbs, for being so mindful and knowing how to just really just shed light and just respect what people are doing in the community. So at this time, I want to, Dr. Bibbs just touched on it. I want to put this flyer up on the screen, and we're going to show it again later also. But Dr. Bibbs is doing something amazing as it relates to health. And so I just want to put this flyer up on the screen real quick and show you all a little bit about it. Dr. Bibbs, would you like to just kind of touch on it a little bit more?
Absolutely. So here at the Ask a Doula Center, what we're doing is we're, really helping our families, women in general, to understand their metabolic support and help and those type of things. I recently, lost 70 pounds on peptides, and I was super excited about that. And to the point that I was like, how can I really help, our families? How can I help our moms postpartum and not just sit and, not have something to look forward to. So I started to use Slank on my own. It's a nasal spray. And I started to use that just to help me with cognitive clarity and, just staying focused and things like that. And I started to do a little bit more research and realized how important it was for my moms, because they were going through a lot of, anxiety and stress and depression and things like that. So this is just amazing. I put this flyer together. We're now offering the scan where we're doing the biometric scans just to help with moms with their metabolic support, and also incorporating, you guys hear me talk about peptides, but incorporating the peptides to help them and support. So it's all medically supervised and so forth. So I'm super excited about that. It puts mom back in charge of her health and put her back in the space of that. So she could be absolutely amazing and available for her new baby, her family and things like that. So I'm excited. I'm just hyped about it. Knowledge is power, y'all. You know what I mean? So thank you for that, Dr. Carla.
Absolutely. So everyone, today, we're not just talking about it. We are being about it. So we have resources available for you, support available for you. Reach out to Dr. Bibbs, connect with her. Make sure you get these peptides. Come on. We see the results in her life and many others. And I'm telling you, they are a game changer right now. So it's been amazing. And we've been going on and on talking about these amazing products that are available that many people do not know about. All right.
Let me put a disclaimer. We are not medical, this is not a medical conversation or anything like that. This is definitely on your own, but at the same time, we just want to share our testimony in regards to that.
Absolutely. Still run it past your medical professionals if that's what you need to do. Okay. All right. But we just want to share that information. But at this time, we get ready to transition into a brief intermission. And we just want to thank Dr. Bibbs again, our amazing host, for this vision, bringing this awareness to each and every one of you. Listen, don't go nowhere. We are getting ready to have an amazing conversation forum. So listen, and y'all still have time to invite people in. I want you all to engage in the comments, ask questions, prepare. But I'm going to show a short video during this intermission. Grab your snacks, grab your notepads, tell somebody to hop on because we are getting into it. All right. So just a moment as we're getting ready to play this short video. Okay. All right.
I never wanted anything so bad in my life. I wanted to prove the world. I wanted to prove my community that I can be successful. I can get a degree from the #1 HBCU. I can get married and fall in love. When I had my miscarriage, I was numb. I didn't know what to do. I didn't know who to call. It was hard. When it came down to getting pregnant again, it was a fear that lived with me. So when things start to arise, like issues, I'm like, hey, can I come in? What I need to do? Because I'm not trying to lose this baby. Please help me. And I was constantly dismissed.
16 weeks, I created my perfect birth plan. I was planning my maternity photo shoot. It was supposed to be at the beach, and we were going to reveal his godparents there. And then one night, I just wasn't able to breathe. And so I was like, I don't want to go to the hospital I was supposed to give birth in because they had already turned me away. So that was the second time they turned me away. I had gone there about week 14 of my pregnancy with the same pains that were in my ribs, and they had already given me morphine for the night and discharged me. My blood pressure was 186/89. That day, I saw that plan crumble like really fast. The second he said the baby needs to come out now. There's no way. I can't do that. He's not big enough. He wasn't even 2 pounds yet. My baby wasn't home with me for the first 2 months of his life.
You're fine, you're young, you're active. Like, these are the things that was said to me.
A lot of these moms, unfortunately, their pain isn't being acknowledged, it's being dismissed. Some of these moms aren't making it home.
Black women, maybe some Black women are not heard as they ought to be heard because the listener is not sensitive to that voice.
There was 30 other nurses in the room at this point. They're preparing me for birth. So everyone's in there. The doctors are in there. Everyone's talking around me, talking to each other. I believe it's called like the charge nurse. She came in. She actually held my hand, got down to my level, and was like, I got you. I won't let anything happen to you. That was the first time in that entire hospital stay that I actually felt supported by the medical staff.
We have some evidence that suggests the result of the biases are diminishing the health of African-American women and likely their infants. But we do need to do some more research to really, tease out exactly in what situations does this happen and what may be some things that we can mediate or remediate that problem.
After delivering my baby, I wound up being diagnosed with delayed preeclampsia. I think it was like 4 days that I was hospitalized from this. And all this could have been prevented if my OBGYN would have listened to me. Is this what motherhood looked like? Because they don't tell me none of this. They don't tell any of this. They give you all the bells and the whistles. Oh, it's so beautiful to have a baby, which it is. It's beautiful bringing life into this world, but it's not beautiful when this world don't support you the way that you need when you're bringing life into this world. So when I found out that I was pregnant with a girl, my mindset shift, because now, and I love my boys, but now I have a mini me. I have a Black woman. And I just thought about her becoming a mother. I wanted to create a space and a platform that can actually keep record of these stories. So not only our generation can listen engage with this, the generations that are coming after us.
It taught me to advocate for myself, and that I could have prevented a lot if I spoke up for myself. And so I became a doula to prepare myself for my next baby, but also be there for the numerous of women who can't speak up for themselves, who may be scared to speak up for themselves. I go there to make them feel safe and supported, and that this is their day, their journey, and if they need someone to speak up for them, I will be that person.
We have been raised, it has been ingrained in us to keep other folks out your business. So we end up suffering in silence. And with anything that you hold down, layer upon layer upon layer, eventually it explodes.
The pregnancies are different from one to the other, but if you want to soldier on and suffer in silence, that may cost you your life and the life of your baby.
As hard as it is to hear, no one can help you if they don't know.
When we tell our stories, we can create actual change. I didn't want to tell my pain because I was embarrassed. You don't have to look at it that way. You have a voice, don't silence it, because your story can help somebody else.
Okay, welcome back, everyone. Just a moment. Bear with us a second here. All right, welcome back, everyone. Thank you again for continuing this important journey with us. We hope that during our brief intermission, you had a moment to reflect, to recharge, and take in the conversations we've already begun having. As we move into this next segment of Awaken by the Silent Cry, we are honored to welcome a group of incredible panelists who bring both professional insight and lived experience to this discussion. This portion of our time together is all about going deeper, creating space for real questions, honest dialogue, and meaningful understanding around postpartum mental health. We invite you once again to engage with us in the comments, share your questions, and remain open as we continue to learn from one another. Thank you for staying connected. Let's continue. So at this time, we want to bring up our first group of panelists for our Community Impact Forum. So our first person we're going to bring up is Rachel Dumas. Our next person we're going to bring up is Consuela Chapman. And last but not least, you've already heard from her, Dr. and Catherine Sylvester. So right now, I just want us to go ahead and let's just give them a warm welcome. All right. I am just absolutely loving our applause feature here in our platform that we're using. And so right now, we get ready to get into it. I want to first thank you, ladies, for agreeing to be a part of this forum, to be a part of this conversation. I want to thank you in advance for everything that you are doing for our community, and just coming to just share information and awareness to the cause and to the purpose why we are here to discuss postpartum mental health. All right. And so before we get into the questions, I want you all to just take about 30 seconds apiece and just tell us just a little bit about yourselves and where you're from and your background. And then we're going to get into the conversation. So let's start first with Rachel, then we will move to Consuela, and then to Dr. Catherine. Okay. All right.
Absolutely. My name is Rachel Dumas. I'm a registered nurse, also a patient with lived experience. I had 9 pregnancy losses before I finally had my baby, who is now a 3-year-old potbelly toddler, as I like to say. But then after that, I woke up with acute vision loss and stroke symptoms and went to the ER and was completely misdiagnosed with a stomach bug because the doctor refused to do a CT scan, which is standard of care. That later led to 2 brain surgeries about 8 months ago. And because of that, I started a maternal health nonprofit to help moms navigate their difficult pregnancy journeys, as well as a patient advocacy app called Heard to make sure every patient is heard within a healthcare setting. So that's a little bit about me. Thank you for having me, everyone.
Awesome. Thank you. Consuela?
Sure. And I just want to lead with Happy Mental Health Awareness Month. I'm wearing my green. So I'm Consuela Chapman. I'm a licensed clinical social worker, licensed clinical addiction specialist. I specialize in trauma, and I am a birth doula and certified meditation teacher. I have been in practice for over 15 years. I'm the owner of Choices in Wellness, and I had the pleasure of meeting Dr. Bibbs last year, where she was a panelist on our maternal mental health panel for my Bloom Together maternal mental health event we had in Raleigh, North Carolina.
Wow. Oh, wow. Thank you so much for sharing that. Thank you again for being here. All right, Dr. Catherine.
Hi, I'm a physical therapist, mommy of 2. I have both of my babies at home. I've been a PT for 16 years, and I essentially monitor moms for better births and recoveries using smartwatches and really any other device they can get their hands on. And postpartum is where it started. I do like people to know that. I didn't know how to regulate my body and my blood pressure as well as I thought I did. Postpartum bodies are different than regular bodies. And so having a little help, someone to walk the journey with you, can really make all the difference. And that's what I learned postpartum. And I'm so excited to talk about everything with you all today.
Awesome. Wow. Thank you so much. So we want our audience to know that we don't have just anybody up here, but we have people who are knowledgeable and educated and have experience on the subject matter. Okay. So we're going to get right into it. And my first question, I'm going to direct to you, Dr. Cat, even though, you just ended there, but I believe this will be a great question for you to open up. And any of the other ladies, you can jump in after her and piggyback on this as well. But the first question is, what exactly is postpartum? And what does it really look like?
So I love to say postpartum is forever. It is after you have a baby, whether the baby is here or you lost your baby. And it's really just after your body is finished carrying a pregnancy. And so I believe that postpartum looks different for everybody. And depending on how much support they have, it can be really easy. How much and what kind of support they have It can be really smooth or it can be really scary. The other things that impact postpartum are how the pregnancy went. So, if someone ended up having a postpartum hemorrhage or preeclampsia, or they almost lost their lives, went into heart failure afterwards. We need support. Postpartum should look like a lot of providers wrapping their arms around this person and meeting them where they are. So preeclampsia, you should have a kidney doctor on board. If you had a heart issue, cardiologist should be by your side. If you are on medication and you want to come off, which we should, then you should be really linked up with your primary care doctor. So it can look very supportive, even if something has gone wrong. But sometimes it can look like the single mom having to still take her older children to and from school. And so she's being told by people, hey, you should be resting the first 14 days after you deliver, and she can't. So it can feel defeating and overwhelming and scary. And so what I like to say about postpartum is let's do what our community is used to doing, and that's showing up for each other. That's church members coming over and cooking healthy meals. That's, parents coming and staying for weeks to help out. That's friends, taking the older ones out so that you have time to yourself. And it also means women choosing themselves. For me, that's what the watch meant for me. When I woke up and I looked at my stress or my body battery or my blood pressure, I was able to say, okay, everything looks good today. So yeah, mommy will make breakfast and we'll go to the park and we'll have a normal day. But if I woke up and my stress was high and my blood pressure was elevated and I wasn't feeling my best, then today is a movie day at home and daddy is going to take over those responsibilities. And so it can look really, really great with the right support.
Wow, absolutely. Thank you so much for really breaking that down. Did anybody else want to chime in on that one? Okay. All right. So we're going to move into my next question. So that was really good to break that down. So my next question is, and I'll direct this to Rochelle. What are some warning signs of postpartum? Because I know that many women, especially young girls who get pregnant, especially teenagers, they may not have been educated on what's going on with their body. And they start experiencing some different things and they have no idea, because I can truly say for myself, I was experiencing some things. No one never told me. I didn't know what was going on. And I was like really bugging out. So can you tell our viewers today, what are some early warning signs that you may be experiencing the effects of postpartum?
Yeah, so one of the things, that's a great question. So one of the things I want us to get away from is just calling it postpartum, because postpartum is a period that never ends. It's just, it's an umbrella term. It's all, it just has so many things going on in postpartum, right? But it should, and I want to get away from it because so many of us are relating postpartum to just postpartum depression, when that's a period of time that just never ends after you have a baby. I don't care what they say. Some people say a year, some people say up to 6 weeks. It literally never ends. But we're talking about postpartum depression. We also should be talking about postpartum anxiety, postpartum psychosis, all these other PMADs. It's a plethora of them, and we focus a lot on depression when we're impacted by all these other ones. I mean, there are like the typical clinical signs of irritability and sadness and tearfulness and all of those things. But I want to point out that in postpartum psychosis, it doesn't always look like the traditional anxiety or depression. It could be having these severely intrusive thoughts of, I just may do something to my baby or do something to myself, and it's recurrent. There's a lot of symptoms that come along with PMADs, right? But also with postpartum depression too, if that was if we were sticking to that, I want to point out my own case. It's not, some of the symptoms are atypical. Like, people associate with tearfulness and sadness and isolation with depression. But I am the type of person that I've had depressive symptoms or postpartum depression, and I've shown up looking super strong. Like, I show up everywhere looking great. I don't care how bad I feel. When I'm at home, I might feel some type of way, but I have spoken at conferences. I've showed up at work and took care of people and all these things. So we really have to ask the questions, because if you didn't ask me, you wouldn't know what's going on with me at all. So one of the other things I want to point out is that when we talk about postpartum depression, we have to ask the questions. We have to make sure we're following up, but we also should talk about our partners. Like, my husband would come to every appointment and they would only question me about postpartum depression and anxiety too. And it's so important that they're evaluated as well, because that could impact our journey, especially our postpartum journey. They may be in a place where they're severely disabled by their depression or anxiety or even psychosis as well, that they cannot be of assistance and fulfill their duty. So it falls on the mom. But when we talk about postpartum depression, it's so much that can show up. We can show up in so many ways, and I just want to point that out to everybody, that it doesn't always look the same for across different patients.
Wow, thank you so much for sharing that. So it was brought to my attention, Rachel, that you actually have an app that you have to help assist people. Can you just tell us a little bit about that real quick, and then we're going to move to Consuela?
Yeah, so I have an app called HERD. It stands for Human Enabled AI Reporting and Documentation. And throughout my 4-year pregnancy journey, and then my what seems like an everlasting neurological journey, where I woke up with stroke symptoms and blindness, and I literally woke up with vision loss every day for 6 months postpartum. With a newborn baby, which is crazy. But I was dismissed. I was gaslit. I was medical racism was an issue. And the only reason I literally survived, I was planning my funeral literally a year ago. I only survived because I had connections to neurologists and different colleagues I work with at Grady here in Atlanta. I did research and found that GLP-1 decreases pressure in your brain. So it prevented me from having a third brain surgery. And I was able to speak the jargon and advocate for myself. And I realized other patients cannot do that. Anybody else would have died during my pregnancy journey or my neurological journey, literally anybody else. And I created an app to help people be able to have a voice, be able to translate that medical jargon, be able to have advocacy scripts so they can say, hey, here, say this to this person, and this will hopefully get you a treatment. If not, let us know this is how we're going to proceed, and to escalate harm within 60 seconds. So yes, that is HERD, and I am very passionate about people having a voice in their care in order to lead to optimal healthcare outcomes.
Wow. Okay, I just need to take a moment to take all of that in, because wow, Rochelle, that is just amazing. I'm sitting here looking at you like you're literally a walking, talking, breathing miracle. And you just said all of that so sweatless, like blown away, that you just been through so much. You've been through all of that. And when I tell you, girl, you don't look like what you've been through, I'm telling you. How many believers on here, but it looked like the hand of the Lord to me. So I appreciate
you so much.
Listen, and any of you who are viewing today, you have experienced some of these similar things. Listen, reach out to her, get her app. For what I understand, Dr. Kat has an app as well to help you understand this terminology, the medical jargon, to assist you with. Oh my God, when I'm listening to your story saying you had these strokes, you had brain surgery, like OMG, like you could have been, but you're here amazing and spreading awareness. And a lot of times people often say that your pain will end up turning into your assignment. And so I'm just excited to hear your story, and to know that you have everything you went through. You pull from that. You didn't just stay in the defeated place, but you took that experience and made something positive out of it to help somebody else. Wow.
You preaching this morning, Dr. Carla.
I'm telling you, I got stirred up, because I'm telling you, you just woos through that like, yeah, this and that, this and that. And I'm like, OMG. I would have been somewhere still probably crying, like, oh my God. But anyway,
It happens.
I'm telling you.
I promise you, it happens. Thank God for therapy, right?
Listen, thank God for therapy. And this is what we were talking about earlier. It's so important to have the medical support, the health support there. And for what I understand, GOP #1 helped as well for you.
Yeah.
So listen, did you want to say something on that real quick?
Yeah, so we associate GLP-1s with diabetes and even weight loss, and it's coming out that it's helping other disease processes, which is great, even addiction. But what a lot of people don't even know, and I even told both of my neurology teams in Kentucky and in Atlanta, because I got treatment in Kentucky because I got stuck there trying to pursue higher education. It was a lot. But anyways, I found an article that was 19 years, a study that lasted 19 years and had 44,000 patients with my rare brain condition. And it showed that in the first 12 to 24 hours, it decreases the pressure in your brain. And at 3 months, it decreases mortality. You get off your medicines and it decreases the need for a surgical intervention. So it literally saved my life. And we would have never, who would have thought? And that's why research is so important. And also that's why I made sure that was at the forefront of my app to say, hey, you need to be active in your plan of care. Because if I hadn't brought this research to my provider team and say, order this medication for me, then I would have had a VP shunt. And that's a life of being in and out of the hospital. And that's a horrible quality of life. So, thank God for research, and thank God for having a team that listens to me and they order what I ask them to order. So we have that trust.
Absolutely. Listen, viewers today, do your research. Do not ignore these signs, these warning signs, some of the things that we're mentioning. You're not crazy. Just don't brush it off, but figure out what's going on with you, what's going on with your body, and do the research. And this why this platform is just very important for me. And we talked about that earlier, that mortality rate. And just to know, Rochelle, that you're still here, like my heart is warm right now.
Thank
because it
you so
could have
much.
went another way, honestly.
Yes.
And so I want to go ahead and move to Consuela. I have another question, but I didn't know, did you want to piggyback off of that, or are you ready for the next question?
You can proceed with the next question.
I can proceed. Okay, good. Because you had that look on your face like you was ready. So, my next question to you is, how does trauma impact postpartum care?
Well, when you think of where the trauma developed, right? Whether it is childhood trauma, relationship trauma as an adult, or birth trauma, it's going to vary. But the behavioral and cognitive effects of trauma are going to pretty much be the same across the board, where you have the hypervigilance, the emotional numbness, for example, the lack of attachment that can develop when it comes to a mother and her baby, all play a role. And when we think of trauma in the concept of its effect on relationships and connecting with our support system, because isolation is involved in that, right? It impacts your trust. Trauma impacts your self-esteem. It impacts the way you communicate. So if you kind of tie in what I said about depending on where the trauma derived, if we're thinking of like childhood trauma, and we grew up in a household where we weren't empowered to use our voice, we weren't empowered to question authority. Guess what? When you get in situations where you think the medical professional is the expert, and from a clinical lens, one might argue they are the expert, but I'm one to say, no, you're the expert when it comes to your symptoms, what your body is doing, and advocating for yourself. And so that was really kind of the premise behind the video, Reclaiming Your Voice, a Black women's health imperative, is because if we're not speaking up for ourselves, or we don't have a doula that's going to advocate and help us, coach us on the words that we need to use, you're more likely to be re-traumatized.
Wow.
I would like to speak on that, Dr. Carla, as well.
Absolutely.
Just from a person who's been through trauma with very lived experience. So, like I said, I had 9 pregnancy losses before I finally had my baby. Up until the birth, I was joking with the anesthesia team, rolling back to my C-section because I have to have one because I have a cerclage. And I was like, if y'all say an alien is coming out, I would be more apt to believe that than an actual baby. I was in complete shock when I gave birth and the baby came out of me. And it complicated my bonding experience after that. Like Consuela said, for a month, that was not my child, that was my patient, and I was his nurse. That's what it was for a month. And it took like some real deep trauma work for me to say, all right, and intention to say, you know what, he's not going anywhere. All 9 babies have died, but this baby is going to stay. This is my baby. I'm his mom. It took a month for me to like really turn that switch on and say, okay, I'm going to accept that he's not going anywhere. And it did cause, like she said, isolation. I didn't even want that much help because I'm like, this baby is not staying. Like, I don't want y'all getting too attached. I don't want to get too attached. It was a lot of trauma surrounding that. But now that's, you know, that's my road dog, you know, we go everywhere together. But it took a while to get there. And then waking up with vision loss 6 months later, I'm re-traumatized because I'm like, oh my God, I'm going through a big health issue, and I don't even know what this is with the newborn baby. And now I was worried about him not being here. I'm worried about I'm not going to be here. So it was so much trauma. And then it complicated my pregnancy journey. I had to stop breastfeeding earlier than I wanted to. You know, I woke up blind every day and it progressed to blurred vision. And at nighttime, I may or may not have my vision back. So I couldn't see my baby all the time. So that complicated the bonding process as well. So it's so much. And that's why therapy is so important.
Yeah, I thought that was just so interesting because of the trauma of losing a baby 9 times, that you did not allow yourself to connect with this baby and get attached. It was almost like a protective or a defense mechanism to protect yourself from another loss, you know.
100%.
So I'm sure you're not the only one who experienced this, and there's some viewers maybe going through this very thing, and this is a real thing. And for you to say it took about a month for you to accept the fact that this is my baby, and then after you do that, now you're going through health issues, which is traumatic as well when you need to be there for your baby. So wow, I'm telling you, this is very, very interesting. So I want to ask Dr. Catherine right now, what type of support should mothers be receiving early on when we hear stories like Rochelle, and we're grateful for the foundation Consuelo laid for that. But what type of support should mothers be receiving early on to help us work through these things?
Yeah, so moms should receive all the support. Whatever support is available, she should have access to it. What I like moms to hear though is that before you get pregnant, make sure your body is ready as it can be. Pregnancy is referred to as nature's stress test. And so the kidneys are going to work 50% harder. The heart is going to work 50% harder. The pancreas is going to have to work harder to get blood sugar out of your bloodstream. Your liver is working harder, every part of your body. And there are numbers associated with better health. So if you have hemoglobin that's in a good range, if your resting heart rate is lower, so trying to keep it closer to 60 beats per minute, if you blood pressure, if you get your blood pressure optimized, what they say is less than 120 over less than 80. So if you're thinking about getting pregnant, hemoglobin, A1C, I want to make sure I say that too. If you are pre-diabetic going into pregnancy, you could have more complications. So I would say know your numbers early, because once you have access to those numbers, then you can make health decisions that get you as ready for pregnancy as you possibly can be. Some things we can't predict. And so that's why I will also say, in addition to making sure that you're as healthy as possible, make sure that you start interviewing your OBGYN if you choose to have one. I had midwives and I'm grateful that I did. And so, talk to that midwife ahead of time. And then you never know who needs to be on your birth support team, because Rachel would have never thought she'd have to see an optometrist or possibly a mental health therapist, right? I didn't know I would need a kidney doctor or a cardiologist, but because I worked in a hospital, I had already vetted them years before I was gonna have my baby. I said, I know when I'm 60 years old who I want to see. And that was because I had already done my research. So I'll tell moms, do your research before you need the person. Know them before you need them. That's what we can do for ourselves. And then the other, so in addition to just kind of knowing, also knowing what's in the community, who can help with transportation, housing, food, childcare, employment. So if you should run into any issues, what nonprofit organizations are available? What county collaboratives can provide support? Because they're out here giving diapers, wipes, like Uber vouchers so you can get to and from your appointments. They're doing it, but we don't always know where the resources are. So what I would like moms to really start thinking about is, who is my community? Because they deserve it all. But if we don't know what's out there, we don't have access to any of it. And like Rachel said, it's interesting, you can have people on your team, then they're not on your team when things go wrong. And my midwife was great. She caught my preeclampsia when my blood pressure was still actually very low, but it was because she knew my baselines. And so where I could have had a traumatic birth, my birth was great. Both of my births were great, but the postpartum period wasn't, because I had an OB who took over my care. And he looked me in the face and said, "You're Black. You lived most of your life in the South. You probably had high blood pressure before you ever got pregnant. I know you don't have a primary care doctor and probably wouldn't follow up with him if you did. Your kidneys will never heal. You'll be on blood pressure medication the rest of your life. And on the off chance that I'm wrong, your body is not suited to have another child." And so when you think about it, you have somebody like that who's supposed to be giving you support saying, this is the best that it's going to get. That's what some people hear and what some people are exposed to. But like Rachel, I'm a physical therapist. So I'm sitting here like, okay, I just heard everybody I need to have on my team. That's not you. I just need you to keep drawing my labs and giving me my numbers, but I'm going to recruit the people who I need now. And so I think that's what it is. What moms need change based on where they are. And so we can't just have a list of people that they need on their team. We need to be walking the journey with them every step of the way so that we can say, wow, your heart rate rose up real high while you were sitting behind the desk. An endocrinologist may need to be on your team. It seems like something's going on with your thyroid. We may have someone who is completely depleted of energy. She feels like she's passing out at work. She needs a hematologist potentially on her team. We have women who are waking up gasping for air. They can't breathe. Their husbands say that they started snoring all of a sudden. They might need a sleep study. And so what I think we need is what I felt like I needed. And it was somebody to just walk the journey closely with us so that they can tell us what we need. And that's what we do with Operation Miss. I love being on the journey with moms, because it literally is day to day. We are helping them figure out, what resource do you need today? Today, you don't have childcare. So let's hope you find that. Today, you were told your blood pressure is elevated. Let's find some food resources so you don't just go to the Burger King that you can walk to, but you get food delivered to your home that's healthy and good for this phase of life. So I think what women need are people who will walk side by side with them, people who can be in their homes without having to be in their homes, right? And connect them to resources so that they're not out searching for them. The most, I think, the deflating thing as a mom postpartum is to be given a list and saying, hey, you need to call these people. You need to follow up here. You need to set up these appointments. What if we had somebody who did it for them? And that way, all they had to do was show up or be ready because someone was actually going to show up in their home. I think we need a complete revolution of the way that postpartum is done so that moms don't have to go anywhere. And I say this because just yesterday, I woke up, her blood pressure was 124/91. The 91 is concerning, right? But in her mind, I got to get my baby to her doctor's appointment. And so, no, you don't have to. You can call the pediatrician and say, look, my blood pressure is a little bit elevated. I'm afraid that it's going to keep going in that direction if I leave right now. Can I just retake my blood pressure in about 2 hours and bring my baby then? They don't even know they can ask for that. Can we do a virtual visit? Can someone come out to my home? Moms need the support to know, like Rachel has said, that you can ask for more. You can ask for something different. And we can give you that template. And I think that's what we need. And then, not visiting trauma, but dealing with trauma before we get pregnant, before we have the baby, before we get into postpartum. And I love what Ms. Consuela said. We need to make sure that regardless of where the trauma started, that we don't carry that forward into motherhood, because it will keep showing up until we bury it. Like, we have to let it, we have to deal with it so that our babies aren't being impacted by it, our families aren't being impacted by it. And I think that mental health support is so important in that way. It doesn't always look like therapy. One way that we caught postpartum depression a few times was that people change their patterns. And so it's like they're always on camera for our meetings and all of a sudden they're not. Or they always open their app at 11 a.m. and now it's 2 p.m. and we hadn't heard from them. That's how we've caught it, because we pay attention to people's patterns and then we ask the question. And so I think that's what we need to, just more people willing to ask the questions.
Wow, Dr. Kat, I think that is so amazing. And that's why I'm so inspired that you and Rochelle both have created these apps to, have that support for women. And like you said, it's not just about sending a mother a list of stuff, call this, call that it takes a village. It takes a community to pay attention to those who are around you in your family, who's pregnant, who just had a baby, and to be mindful and notice if something's different going on with them. And at the moment that you know that they even got pregnant, already start pointing them in the right direction for these resources. And I think that is just so important. But listen, real quick, we are running out of time for this session. And so I have to wrap up this session here. But this was so great. This was so important. This information here was absolutely amazing. And I'm telling you all, take all of this in, connect with these women. I want Consuelo, Rachel, Dr. Kat to put your ways that people can get in contact with you in the chat so they can connect with you, be a part of what you're doing. We have to close, but I just want Consuelo real quick in 30 seconds, just share some last remarks that you would like, the audience to know, and then we're going to transition for our next panelist, okay?
Sure. I just want the audience to understand that, what you're feeling is real, that you are the expert in your care. Your voice is your power tool, and silence feeds shame. And so there's still a stigma, and using your voice and normalizing, hey, I am depressed. I am having anxiety. Baby blues is supposed to last for 2 weeks, up to 2 weeks. But you know what? It's going on 8 weeks for me, and I'm not feeling the same. And that's when we need to get help, right? And there's nothing wrong with getting help. Having a baby is not the time to be the superwoman. It's the time to be mommy.
Wow. It is the time to be mommy, not superwoman. It's okay, viewers, to ask for help. We need help. And as someone already stated, that when I was pregnant, I wish I had doula services. I wish I had a support, because listen, I would have passed that baby to the doula and I would have been sleeping every night for 30 days. Listen, I say that all the time. All right. So thank you again, ladies, so much for your contribution today with spreading awareness on postpartum maternal health. Thank you, thank you, thank you. And we're going to go ahead and remove you all from the screen and get ready to transition to our next segment. And so those of you who are on, I hope that you are taking it all in and making and taking this information to apply to your life, and connecting with these women. They're putting their information in the chat. Go and follow them. So right now I'm getting ready to show you a short video clip, and then we're going to bring up our next set of panelists. All right. Thank you.
Is your daily routine lacking nutrients? Isotonics Complete Greens helps add nutritive value to your diet with organic greens and aims to improve nutrient intake and help maintain a healthy digestive tract. Complete Greens contains organic ingredients carefully selected for their efficacy in supporting optimal results, with the added benefit of our Isotonics delivery system, which features rapid absorption and a high concentration of nutrition for maximum results. Empower your day with Isotonics Complete Greens.
All right, all right. Okay, so welcome back, everyone. So at this time, we're getting ready to bring up our second group of panelists, and that is none other than Antoine Dwayne Jones. And we're going to also bring up Teresa Johnson. And last but definitely not least, our host, Dr. Tenisha Bibbs. All right, welcome everyone. All right, so we getting ready to get into it. It has been absolutely amazing so far. So real quick, before we get into the conversation here, I want you all to do the same as our first group of panelists and take 30 seconds only and just tell us a little bit about yourselves. We're going to start with Antoine first, then Teresa, and then Dr. Bibbs, okay?
All right. Wow. Start with the guy first. That's a new one for me. I was waiting to be all chivalrous for the ladies, but Antoine Dwayne Jones, I am a member of Phi Beta Sigma fraternity. I am the former chair of Sigma Fathers, where we focused on all things fathers and male, advocacy, mental health, and so forth. And I'm a person with lived experience. I'm a dad of 3, so I've experienced everything from being a single dad to a NICU baby to ectopic pregnancy on the father side. So I'm here to just share and learn with you ladies.
Awesome. Well, we thank you so much for coming to be a part of this and contributing to the conversation. All right, so we're going to call on you now, Teresa.
Okay, well, thank you very much for having me. I'm Teresa Wright Johnson. I am a maternal mental health peer specialist and an endorsed infant family specialist. And mostly I'm a mom that has had 4 pregnancies, 4 births, and I have 1 living biological child. So I have a lot of maternal health challenges, history, and past. And I also am with several organizations, Mom Biz Boss, and the American Mothers of Georgia Association as the former American Mother of the Year, Georgia. So family is important to me. My mom named me after Mother Teresa, and my birthday's on Earth Day. So it's all about motherhood here.
Absolutely love it. Welcome, Teresa, and thank you as well for being with us and being a part of the conversation. All right, last but definitely not least, our host, Dr. Tenisha Bibbs.
Hey. No, I'm Dr. Tenisha Bibbs, a pregnancy and postpartum health coach out of Atlanta, Georgia. I am the owner of Ask a Doula Center and also, oh God, I have a whole lot of stuff. Renew Start Georgia. I specialize in pregnancy, postpartum, and also the early stages of newborns from 0 to 3. And I'm a mother of 5, grandmother of 6 and a half. I'm about to have another grandbaby this month. And I love what I do for families. I've been in the postpartum space for over 15 plus years. And so I love doing this, and I'm super excited to support and collaborate and everything else.
All right. Well, thank you again. And we appreciate you, Dr. Tenisha Bibbs, for this amazing platform. I can't say it enough. And we're so honestly proud of you and what you are doing in the community and the mark that you're leaving here in the earth. So my first question, I want to go to Miss Teresa first. Miss Teresa, I want to ask you, why are women suffering in silence, and what do real community support looks like?
I think women are suffering in silence because a lot of people don't know about the connections or know about maternal mental health. I can think 20 years back, I didn't know about maternal mental health. So they may not have a connection. They may not have, like someone said on the last panel, they don't have a peer or someone to walk side by side with them. So they don't know where to get help. And then if we think of disparities, I'm a woman of color, but I was listening to something earlier today. And from being in this whole realm of community health, it's not just being people of color, it's access. And so having access to service or care for just a regular OBGYN. Let's not talk about a specialist. So I think people are not getting the help or know what's available because it's not talked about enough. It's not a part of normal healthcare sometimes when it should be, because it's the beginning of life. And so that's how I see it.
Wow. I definitely agree, and thank you for sharing that. Absolutely, we have to know how to find these resources and how to connect with people. And so my next question is to Antoine, and I just really want to say this first, that I'm just truly honored that you are here as a man, and we really need to see more men get involved. So just your representation of being here today just really blesses me and also warms my heart. But my question for you is, how can fathers support maternal mental health or postpartum mental health? How can fathers support, get involved, and just kind of tell us what you're seeing today?
Well, I mean, I guess my first thing would be, it's just like, you know, if the airplane is going down, then you need to put on your mask first, right? So the men need to be mentally prepared in researching and supporting, being at the appointments, be present at these appointments, but making sure that they're mentally prepared and understanding of everything that's going on, so that if there is an issue, if there is a problem, and they do come, that they're knowledgeable about it. They're also capable of handling their own emotions and such, and that gives them the best opportunity to help mom and baby.
Oh, wow. So let me ask you this, Antoine, too, like a part two question, because I've actually heard people say that, and this could be a myth because many of you all are healthcare professionals and specialists on here, that sometimes men have symptoms of, of postpartum as well, or they may, I don't know, or they empathetic or picking up the symptoms of their wife, spouse, or significant other as they're going through this, but they may even have symptoms as well. Do you know anything about this or have any insight on that?
Yeah, I think it's just human nature. I think people forget that men have feelings and emotions too. But just think about it. This new baby comes in the world. Then if you're a protector, provider, or you got to figure out how to take care of the baby. You got to figure out how to take care of mama. And you see mom's going through something, and you may be depressed because you can't or don't know how to help her. So those are the things that go through men's minds when they're relating to this postpartum thing, because you can't be depressed because you think, I mean, I'm helpless here, or I'm useless in this situation, and then that could spiral into something else. So if the emotions or morale is already low, then that's just going to make the man feel even worse, because he's not sure what to do, because there's no blueprint of parenting as it is, right? So you don't even know. We're just throwing paper at the wall anyway, right? For a while, but it does make for it to be an emotional roller coaster for the fellas too. And then again, if those fellas weren't actively involved in all the doctor's appointments and the conversations with mom, and he just sitting there like, I don't even know what's going on. What's ectopic pregnancy? What's this? What's that? I mean, he just totally lost, and that could just spiral into something even worse on his emotions.
So Antoine, I think it's so important too that men really get involved as well and educate themselves on the subject matter, so they would know what's going on with their spouse, with their child's mother, if they're not married, to really be able to identify these signs. And and I was initially going to ask you what were some ways, and you kind of touched on it a little, how they can kind of lighten the load for the woman when they see her going through these things. But like you said, sometimes it could be so overwhelming for a man, like, because he's still got to work and provide. But then there's the mother may be here sick and going through symptoms. Like I was thinking about Rachel, part of the first panel. She just had this baby, but now she's going through strokes, brain surgeries, all of these things. But there's this baby here, and this man still have to work. Like, a lot of times we forget that men need support. Men may need therapy. Men might need counsel. And so I just kind of wanted to mention that aspect there, on how important it is for men to get that support.
Right, absolutely. Know yourself. I mean, if you know yourself, then you'll be able to function a little bit better when those times come.
Wow, absolutely. Wow, thank you for sharing that on today. So now let's come to Dr. Bibbs, let me ask you, how can everyday people really get involved, with supporting these mothers? How can everyday people really get involved?
I think it's the same thing with the fathers. Like kind of understanding the process of it. You have to be willing to understand and be willing to learn. So a lot of times what happened is that a lot of people don't know because the information might be out there and it might be from different places and organizations, and it might be on brochures and flyers. But if you're not interested in reading, or if you're not interested in getting involved, then you're not going to know. And I think it's important that when you're talking about community, depending on which aspect you're coming from, if you're talking about community or you're talking about family, you're talking about how do we get involved? We have to show up. You know what I'm saying? How do we show up? We have to be open for the conversation to be able to say, so for instance, if mom is going through her doctor's appointment, sometimes the father might need to show up in that appointment to see what's going on with the ultrasound. You know what I'm saying? That's how they show up. And then being involved. I know when I go into my family houses, it's like, oh, my husband is like the person, the go-to person, because he wants to know everything. He comes in the room and he watch me change the diapers. He comes in, how do you do this? How do you do that? So I think when it's almost like back in the day when the community knew everything about, when we were younger, we would hear one hand washes the other, or when we were younger, we would hear it takes a village, right? So I feel like it still does. And at the end of the day, you have to get involved. You have to know what's going on. You have to be willing to learn and be open for it and things like that. So that's how I feel the community can get involved in things, especially when we have events, stuff like this. Get involved, learn these type of things. What we do is we got all these stuff going on. We got the Brave games and we got this stuff, but we don't know what's going on with the mom in her pregnancy and don't realize that she's going through postpartum depression, distress, and things like that. And then she's pretty much going through that by herself because we have so much going on in our life that we have to take the time to get involved and be present in the moment of what she or whoever, it could be dad, whatever it is. Like, for instance, when you ask the question to Antoine, it's like, if I am a woman and I don't see that he or that man needs that support, I won't know that he needs that support, especially if he don't open up and say he needs the support. So I won't know that unless I get involved with him to say, okay, I know there's something going on. That's how I believe the community can get involved. They have to want to get involved with what's going on. There's way too many people out here doing so much that we can't have an event over here and no one wants to get in, no one comes to it because it doesn't pertain to whatever their situation they're going through. But if you come and learn the information and you see these people are pouring out and you see that the people are giving and you see that the people are spending all this money on these brochures and banners, then you go out and you support. So you know what's going on, not only in your community, but what's going on with mom in pregnancy, what's going on in postpartum, what's going on in maternal health, just like the legislator, she said the same thing, get involved. So that's what I believe.
Absolutely. Thank you so much for sharing that. And I definitely think that is so important. We have to get involved. And you said something that stood out to me, that sometimes we host these events and the people don't come. Many of them don't come because they don't realize it's a thing and how important it is. So that's what I love about what we're doing it today. Since they won't come, we're bringing it to them. Yeah. We're bringing it to social media. We're bringing it on these lives. We're bringing them on these forums to make sure that you are enlightened, you are aware, you are hearing about it. We're having a conversation so you can realize this may be something that I need to participate in. And many of you may have had family members that have suffered, whether it was postpartum depression or different things like that, or had near-death experiences, and you really didn't know what was going on with them. You didn't even know what support or information was available to them. So my next question.
Wait, I want to say something real quick. Yes. Teresa is very good with that. She has a Mom Biz Boss, and we are all in like a community, and she throws out events and we go to those events. That's just how it is. We show up. And even if it doesn't pertain to what we're doing in our actual business, it's something that we may meet somebody there that may say, oh my God, I need this, I need that. So I think being a part of communities like Mom Biz Boss and the things that Antoine is doing is going to put you out there. He does so much for the HBCUs. It's like, if we don't and get involved with what he's doing, how would we know how to participate? How would we know how to support? Yeah,
absolutely. So, Ms. Teresa, can you tell us about some of the community events that you're doing, and how we can be a part?
Sure, but before we go into that, when you were just talking about the postpartum depression, I just wanted to get into that really quickly because I don't even think I would be a maternal mental health peer specialist or an infant family specialist if it wouldn't have happened to me. And I didn't know it was happening to me. And then I love what Antoine said as a man. At the time, my ex-husband, he really was getting on my nerves. He was very emotional, but I was only like 21, 22. And he was like talking about, I'm going to work and I'm telling them we just lost a baby and I'm going to be off. And he was totally emotional, and it's a whole different level. And then just imagine, we ended up losing 3 other children and having all 4 children be preemies, and 2 of them being born with special needs and all sorts of things. But now my mind knows, because of the study and what I've been exposed to, that 20-something-year-old girl and that 20-something-year-old man was going through postpartum like things. And that was that first birth. I had no clue. But by the time we had that fourth child, I was experiencing depression. I didn't know that. I didn't know I was experiencing postpartum. So I think that community is important, because if I had been in a community, and honestly, I was in a community. I'm actually about to go to a tea party for moms. That's one thing. You got to take care of yourself, take time for yourself, and connect to community. But I'm going to be with my Mocha Moms, an organization I've been with for 20 years, with my Mocha Moms, having a high tea. But yeah, high tea is great, but being in those support groups. And so Tenisha is forgetting that she's a part of all these organizations, because when you're talking about healthy mothers, healthy babies, we sit on committees with them. I've been awarded as a parent support person with them. Tenisha is there. Let's say the March of Dimes. We sit on the March of Dimes committee, and we're learning about things about not just postpartum and maternal health, but after that baby's born, that because we forget that postpartum health is like up to 2 years after. We had oh, mom had the baby 2 weeks later, we should just be looking at that 2 weeks. We need to be looking into those 2 years, because now that I'm thinking about it, I didn't bond with my child the way I was supposed to, right? Because I couldn't, because my mind was totally dealing with depression and emotion and anxiety. And the young lady earlier, I was scared to bond because I had lost children, and then the one child that I did have had special needs. It's just so much. So community events, we all have events. I would say, look at the March of Dimes. We have the March of Dimes organization here in Atlanta. I know I'm on the community committee for March of Dimes. We do have Healthy Mothers, Healthy Babies. I'm with them as well. I would say I'm an ambassador for the Earth app, right? But then you have organizations like Dr. Tanisha's organization, or when Dr. Tenisha and I are also both members of the American Mothers Association for Georgia. And so just these organizations are having events, and it is about women's health. If we would connect maternal health to women's health, just like we are connecting maternal health to maternal mental health, health is health. And so we connect. I think that's important. And if we share like this video, I know I've already went into Mom Biz Boss and some other places and share this video, somebody might just hear it. Someone may just hear it, because somebody had to eventually connect me to maternal mental health. And it took 15 years later, sitting in a class, learning about maternal health, for it to click and say, that was me. Who wants it to be 15 years later? I want my daughter that is pregnant right now. I have my stepdaughter is pregnant right now, and she will be having a baby in a few months. She has the resources because I have the community to help support her. That's what we need. We need to have those connections in that community now. And then it's a diaper event going on at Grady if you're in Atlanta right now. All of that stuff is great. but are we getting the education along with not just giving families stuff and getting them out to have fun? Knowledge is power.
Power.
And
That's
so
right.
Absolutely.
that's all I have.
I love it.
Hey, look.
Wow.
Ooh,
You got us rowdied up now.
right, let's just look. Can I jump in real quick?
Yeah.
Absolutely. And then I'm come in. Absolutely.
I want to say something, and we can't sugarcoat stuff anymore, right? So let me give you an example. The last part, and I'm not knocking it because it was great information, but it wasn't as hard as it should have been. So we said, hey man, Georgia's one of the lowest in maternal mortality and morbidity. No, Georgia is a F.
Yes.
F. Like, I'm on the Georgia Maternal Health Task Force. Georgia's is a F. That ain't low. That's failing. So people need to know that. So maybe a little fear, a little shaking them a little bit will get them to just start doing a little bit more research, because we're just taking everything so lightly because social media and TV and all that has us all kind of desensitized that things aren't that bad. F is failing. It's not bad. It's horrible. It's the bottom of the bucket, and we need to do something to change that, because as we go forward and the laws are changing, so now if more and more hospitals and urgent cares get shut down, if we already at an F and it took somebody 3 hours to get to a clinic, and now it's going to take them 5 or 6 to get to a clinic from an urban place, then how's that F going to get any better?
But I think Teresa said something very profound. She said, knowledge is power.
Mm-hmm.
Okay. So I think with this movement, this is why I took my health into my own hand, because I got tired of putting my health in somebody's hand and they did it and treated the way they wanted to. So I feel like we need to have more health conversations, teaching moms how to work with their body, like Dr. Catherine was talking about what your body feels and what is this. Even though you might not be in the medical space or a medical doctor, you can feel something's going on. And I think if we have more educational classes that will help with that, then we can understand how do we become in control of that. You know what I'm saying? If I did not, and I'm just going, this right here is not about, mom pregnant and all that and postpartum, but this is about me now. I took matters into my own hand. If I did not do that, I would still be in the space that I was 8 months ago, feeling unhappy, sad, depressed, stressed, and all of that. So I encourage every mom, take charge, man. You are in control. Don't allow nobody to take that control from you.
Absolutely. And as you all were speaking, like literally I can feel tears welling up in my eyes, because I know so many women who had suffered postpartum depression, who were having suicidal thoughts, having thoughts of killing their babies and harming themselves. And I didn't really mean to get emotional right now, but it just hit like a heart trigger for me right now. And I just want to say to any viewer today, if you are having those type of thoughts, you didn't just wake up one day and you're crazy or something's wrong with you, but it could be related to this postpartum mental health. And if you're uneducated about it, you don't know. But if you're having these thoughts, get help. Tell somebody, okay? Because we want you to live. We want your baby to live. And there are resources that are available to you. And don't hide it out of shame or embarrassment that you're feeling these thoughts, because guess what? You're not the first one. You're not the first person. You're not the only one that probably had these type of thoughts that were unusual or unnatural. These intrusive thoughts that can come in that way. And I shared this testimony last time we had this forum with myself, that I was going through some postpartum experiences, but I didn't know what I was experiencing. Now, I didn't want to kill myself, but I was wigging out. It's a funny story that after I had my daughter Savannah, my family members would come over and want to hold her and visit her. And this thing was in my mind that somebody wanted to steal my baby. they want my baby. They want to see my baby. Like, where did that come from? Where like this paranoia, I didn't just wake up like that, And I was having all these different feelings and emotions, and no one explained to me that you may experience different things that's unusual. I don't want to call them weird, but they're unusual. And so I just want to let you all know today, do not harm yourself. Do not harm your baby. There's support for you. If you're feeling overwhelmed and you need support, reach out to somebody. And I want to encourage you, family members, as you are actively paying attention to those in your family who have had babies after they had babies. And I'm glad someone pointed out that postpartum is just not the first week or two after you have a baby, but it could be a couple of years long, or it could be ongoing. Kind of pay attention to them, see if they need support, see if they need help, because a life could be in the balance. So I just want to say that. I want to encourage you all. And I want to thank this group of panelists again for your contribution today, for what you are doing in the community, your passion, your concern. And again, Antoine, and not to just keep putting you on the spot, but just being a man, I'm telling you, it means everything. And we want other men to get involved. You are a billboard today to let men know that this is not just a girl thing, a women thing. It's important that you know what we're going through. It's important that you know what your wives are dealing with, your daughters, your sisters, your mothers, so you can give them the support and help that they need. So at this time, we're getting ready to wrap it up and close it out. And I'm going to remove myself and Antoine for the stage, and we're going to have final remarks from our amazing, amazing host, Dr. Tenisha Bibbs. Thank you all so much for participating.
Thank you. Well, thank you so much. I just want to say thank you so much for taking the time. This was really important to us. Very meaningful conversations that need to be had. I really appreciate every last one of my speakers that was on today that poured from their heart and was able to grace us with the beauty of their expertise. And so I also want to thank my moderator for just really doing an amazing job with putting this together and getting us organized and so forth. I thank just everyone just for being a part of it. Thank my honoree, Dr. Catherine Sylvester, for just really, being just doing what you do in the community and your work. All my panels, they are amazing. This is why I watch them because they are so amazing at what they do. I also want to say thank you to Tamora for just amazing work in the community and what you're doing. I am so happy, literally happy. I want to also put a plug. I want to thank my pastors, okay, Apostle Travis Jennings and Pastor Stephanie Jennings of the Harvest Tabernacle Church. So if y'all need a church, y'all need to come on to my church, okay? But we're always on. You can look on us as Facebook at the Harvest Tabernacle Church, and we, if you need a place to just worship online, this will be great. I just want to thank you guys for Renew Start Georgia Collaborative is definitely pushing the mark. This year we wasn't doing like a lot of boots on the ground. Well, I wouldn't say that. We wasn't doing a lot of like, bringing people in yet, because we wanted to kind of feel the whole postpartum mental health, and we wanted to be helpful to other organizations. So we are doing a lot of collaborating work this year, the rest of this year, supporting, pushing, and then we'll of course come out the gate running on 2027. Those of you can go to, and I thought I had a link here, but you can go to renewstartgeorgia.com, where there is a toolkit. They have all of our flyers, brochures, and things like that. You can go ahead and download what's in there. If you have access to that, it's free to anybody. But if you have access to that, you can go ahead and download our flyers. We have like awareness flyers there. We also have a couple of things that we're doing here at the Ask a Doula Center. Again, we are not just here. We are here to support. You can come in and get your screening. If you're pregnant, we do pregnancy tests. We do first ultrasounds or first trimester ultrasounds. We also do DNA testing here. We do so many different screenings here when it comes to, of course, mommy and pregnancy and things like that. Everything is confidentiality. We also, if you just want to come up here, just need some support, a hug, come chill, come deal. If you just want to come and work on your computer, I mean, this is what we're here for. This is why we're up here. So I want to thank everyone again for joining us today. And don't forget to go onto the website. Please put your information in. I will have some more information out to you all when we have our very first interest meeting for the Renew Start Georgia Collaborative. We are looking for partners and people to be a part of that. Okay. Thank you again. And I am complete, Dr. Carla.
Yes, ma'am. Thank you again, everyone, for attending. And we're going to get ready to end this live stream. But before we do, we want to encourage you all to share, tag somebody that you know needed to hear this information. Go back yourself and watch the replay and take it all in. Go to those comments. And I want you to get all of our speakers' information, connect with those. Vote for our Georgia State Representative candidate. Get involved. We are here for you. And so this is what this platform was all about, to spread that awareness and let you all to know that this is an important initiative. Thank you again for watching us. Until we meet you all next time, listen, May 2nd of every year is Postpartum Mental Health Awareness celebration. Okay. All right. Have a wonderful day.
Thank you.
Bye-bye.